Good morning, everyone. Thank you for joining me for this webinar. Just going to be an Active Health question and answer session. I'm Ashley Martin. I'm the Wellness Coordinator here with SPD. If you do have questions throughout this webinar, please type them in the chat, and I will get to all of them before the hour is over. So let's get started. So Active Health Management is our in 2019, new wellness vendor. They replace most of what Go365 offered us. So they are available to all employees, spouses, and dependents 18 and over who are currently enrolled in an SPD sponsored medical plan. So they offer us, in addition to their wellness platform, on-site and telephonic health coaches. So all of their health coaches have at least a 4-year degree in a health field, in addition to certifications on top of that. So our on-site coaches, we've got the Northern Area Health Coach, Kevin, who is an exercise physiologist. We have our Central Area Health Coach, Sarah. She is a certified personal trainer. She is actually available here in the Government Center Clinic on Mondays, Tuesdays, Wednesdays, and Thursdays by appointment. We have our Southern Area Health Coach, Terry Finney, who is a certified health coach. In addition, on the telephonic team, we've got registered dietitians, nurses, exercise physiologists, certified health coaches, certified personal trainers as well. So a great team to be able to converse with. The number to reach the health coaches telephonically, or Sarah Anderson as well in the clinic, is 855-202-4219. That is also just our general state of Indiana number. So if there are any concerns or issues, please call that number for questions. It's their customer service and their health coaching line. So there are 4 ways available, 4 different paths to earn a premium discount on the health plan of your choice in 2020. So I do want to point out, we are not going to have a wellness CDHP next year. We are offering the discount on any plan that we offer for 2020. So you don't have to pick the high deductible plan. You can apply it to any plan we have available. We don't know quite yet what plans look like. Being self-insured, we've got to be a little bit further through the year to be able to comfortably set plan rates and get those plan options out there. So those typically come out before open enrollment, and at that point, that's when the discount amount will be announced as well. The other big change this year is that both employees and their spouses have to complete one of those 4 activities to earn the discount. So everybody's kind of on their own this year as far as you each, if you're an employee and spouse on a family plan, you each have your own account in Active Health, and you each have to do your own part to earn that discount together. So I'm going to walk through each of these 4 options separately. Like I said, if you have questions, please type them in the chat, and I will answer them as we go. So option number 1 is to complete 4 coaching sessions with an Active Health coach. Those can be any combination of face-to-face or over the phone. What we know from Active Health is if anyone who hasn't started anything yet, if they call by July 1st to set up that first appointment, Active Health has assured us that they will have time to complete those 4 sessions by that September 30th deadline. So definitely call. The first is on Monday, so make sure you call before then. The telephonic team is available 9 a.m. to 9 p.m. Monday through Friday, and then 9 a.m. to 2 p.m. by appointment on Saturdays. And the other thing I'm showing you on the screen is in the Reward Center, each of those 4 options has its own little section that will show you your progress towards meeting that particular activity's goal. So in this one, as you do complete your sessions with a health coach, whether it's in person or telephonic, each date of those sessions, those first 4, is going to show up in that date completed box. And then in the comments, it's going to show completed. So that's a good way to kind of keep track, know where you are. If it's been, let's say you did start already, but it's been a couple months, you lost track of it, this is a good way to check in and see how many more sessions you need to reach the 4. So option 2, reaching level 5, so that's earning 9,000 hearts by participating in digital coaching, health education, and health goals on the Active Health platform. This is another option. If you have not started anything any activity towards reaching that premium discount, you can still start this one from scratch and have plenty of time to finish it. So there are two different ways to earn the hearts on the platform or in the app, and their web portal is also mobile friendly. So if you don't want to download the app, you can still access the portal through your mobile web as well. So all of the activities you can complete to earn hearts can be found under that digital coach menu. So if you hover over that, you're going to get two options. The one is your health goals, and the other one is your health education. So the your health goals section involves just setting weekly goals, and then there are daily activities that you can complete towards reaching those goals. And it's stuff like reading articles, taking quizzes. They'll show you recipes. So each one you complete is worth 20 hearts. So you can earn 120 hearts daily by completing those your health goals actions or activities. So that's 840 hearts per week for the your health goals section. And then in your health education, you can earn an additional 800 hearts a week by reading. It's basically you're reading different modules on health topics. And there are a good amount, I'd say at least 15 different topics overview large topics that each have subtopics underneath them as well. So there's lots of different articles to choose from. And like I said, each one of those separate articles is worth 100 hearts. So you can earn 800 hearts a week in the Your Health Education. One thing to keep in mind is the Your Health Education section will let you read as many articles as you want each week. It's not going to limit your access, because part of the point of this portal as well is to give you information, give you access to different types of health information and subjects. So it's going to let you read as many articles as you want each week, but it will only reward you 800 hearts, so 100 hearts per article up to 8 articles. So keep that in mind. So total hearts per week, if you're doing everything possible daily and weekly, you can earn 1,640 hearts. So it's going to take you at least 5.5 weeks to earn that 9,000 to reach level 5. So just give yourself enough time to make sure you get that done. The Reward Center section for this one will start showing you where you're at level-wise when you hit level 3. It'll show you the date for level 3, level 4, level 5. Some of you may have noticed, if you have been working on this goal, that you've reached level 5, you've gotten 9,000 hearts, but that date completed under level 5 hasn't shown up quite yet. This is an issue ActiveHealth knows about, and that should resolve itself by July. So as long as your levels and hearts at the top right side of your screen when you log into the portal says level 5 and 9,000, know that you've completed that section or that part or that activity. So these next two options that I'm going to talk about, if for those of you who have not started any of these 4 activities, then these 2 options are not going to work for you. If you have not already connected your tracker and have been syncing steps or exercise minutes, it is too late. You do not have enough time to start these options from zero or from scratch. But if you've already started these options, you absolutely can continue working on these options. So both of these next 2 options require a fitness tracker being connected to the portal. Every fitness tracker that connects to the portal is listed under the records menu and then devices and apps. The only exception to that is that Apple Watches are not listed. Apple Health is not listed, but Apple Health, the Apple Health app, and the ActiveHealth app will talk to each other. So you've got to connect. If you've got an Apple Watch, you have to connect to your ActiveHealth app and your Apple Health app. And then when you have a device connected, still under the records menu, there's a trackers list. If you click on that, that'll show you, you can click on steps and exercise, and that'll show you what is uploading to the portal. So this third option is recording at least 45 minutes of physical activity, 3 days a week, through a sync device. It's got to be for 11 weeks of the quarter, and you have to do it 2 quarters out of 3. So these are not averages, these are minimum. So it's got to be at least 45 minutes of physical activity, at least 3 days a week, for at least 11 weeks of the quarter, at least 2 quarters out of 3. This one in the Reward Center is not going to show you whether you hit that goal until you actually reach your 11th week on the 3rd day. So once you complete that goal for one quarter, the date completed is going to show up in that quarter's box, and the comments are going to switch to say completed. If you did not meet this goal for quarter 1, then no date will show in the date completed box, and the comments will just say past deadline. So the best way, if you are working on this goal, the best way to know if you're on track is to check what is uploading under that exercise and steps tracker under the records menu. So then the 4th option is to record 10,000 steps a day through a sync device. It's got to be for 75 days of the quarter, and again, 2 quarters out of 3. So just a reminder, these are not averages. It has to be a minimum of 10,000 steps a day on a minimum of 75 separate days of the quarter, 2 quarters out of 3. The nice thing about this one is in the Reward Center, it will actually show you a running total of how many days you've hit 10,000 steps for the quarter. So it's a little easier to keep track of. You can just log in to your Reward Center and see where you're at. So a few other things I want to mention with these 4 options. So if you're on a family plan, your employee and spouse, you don't have to do the same option. You can each pick whichever option is right for you. You just have to make sure that both of you complete one of these options. If you're on just a single plan, all you've got to worry about is just yourself completing one of these options. If you're on a family plan with adult dependents, children over 18, they actually don't have to do anything either. They have access to all of these services, but they don't have any influence on your discount. And then one other thing I want to mention, so you can actually earn e-gift cards as well. So the health assessment and the biometric screening, they are not part of earning the premium discount. So they are completely separate. If you do complete the health assessment, both employees and covered spouses can earn a $50 e-gift card. And the health assessment can be found on the home page of the ActiveHealth portal as well, and linked in that Welcome to My ActiveHealth box. You can also, both employees and covered spouses can earn $100 for a biometric screening. Both the health assessment and the biometric screening must be completed and uploaded into the system, into ActiveHealth portal, by November 30th of 2019. So you can complete the health assessment on November 30th. Biometric screenings you really need to have completed, especially if you're going to your own physician or you're faxing in the biometric provider form. That deadline is October 31st because it can take up to 4 weeks to be loaded into ActiveHealth system. With the e-gift cards, you do have to go in and redeem those. That can be done by clicking on that reward trophy, the reward section, and choosing where you want your gift cards redeemed from, and then enter your email address, and you'll get a code through your email for those gift cards. If you do not redeem your e-gift cards, they will not be sent to you, and the deadline to redeem them is December 31st. So if on December 31st you still have any gift card that you forget to redeem, January 1st it will be gone. So with the biometric screenings as well, we will schedule more through September here at the Government Center. You can also go to your own physician. If you've had a physical in 2019, basically anytime from January 1st through October 31st, you can have your physician fill out the biometric provider form, which you can find on the ActiveHealth portal or on investinyourhealthindiana.com. Fax that in. The other option is to go to a Quest Diagnostics Lab Center. You can sign up for those appointments as well through the ActiveHealth portal. And those are the only 3 free options to get that biometric screening completed. So at that point, that's everything I have to present on, but please, if you have questions, this is a good time. Type them in the chat box. I will be on the line until 9 a.m., so feel free at any point to ask questions, but I do appreciate everyone logging in. Okay, so the question is if the Quest Diagnostics results will be electronically added or if those forms have to be faxed in. And those are going to be electronically added. So if you go to a Quest Diagnostics location, if you've made that appointment and you take that requisition form with you, Quest will take care of sending those results to ActiveHealth. So you don't have to do anything further. So all of the information in this presentation is available on investorhealthindiana.com. And there are user guides that have those screenshots from the Reward Center. There are FAQ pages as well. So I would recommend check out investinyourhealthindiana.com.